The private insurance industry currently takes 31 cents of every dollar, of every healthcare dollar premium that they collect out of actual patient care. That money is used for overhead, as you mentioned, marketing, exorbitant CEO salaries, administrative costs. We know that the private insurance industry's administrative waste is much, much higher than Medicare, which we can talk about a little bit later. And insurance companies consider that what they spend on patients, they call that the medical loss ratio, which says something. When the money that we're paying to take care of us, they can view that as a loss. So the idea is that for individual plans, the insurance companies now have to spend 80 cents of every dollar on actual patient care. So they can only take 20 cents of every dollar away instead of 31 cents. For small businesses and other plans, they can actually only take 15 cents of every dollar away. The idea is that more money will actually be used for patient care. But because the Affordable Care Act has no provision to prevent insurance companies from raising rates, they can figure out, well, I need to make this absolute amount. And if I can only take 20 cents of every dollar, I'm just going to charge a little bit more because there's no regulation on their ability to regulate rates.
And then the federal government says you can only pay 8% of your annual salary towards health care. Otherwise, you then qualify for federal subsidies.
Correct.
So it would be the federal government picking up the slack there and corporate welfare for the insurance companies, basically, right?
Right. So here's the thing about New York. Prime example. So everyone was touting that New York had this, they opened the exchange and a lot of premiums were 50% lower than what they had been the year before. The idea was
the exchanges have opened in New York.
Well, this is anticipation of them opening in 2014. A lot of people are starting to show the prices. Covered California, which is the exchange for California, announced the participating insurance plans and the prices there. They are actually quite reasonable. And this was a big headline in the New York Times 2 weeks ago that showed that the individual market, the cost would be cut in half by 50% for the individual market. What people don't realize is that's really predicated on the individual mandate really enforcing people, particularly young people, to participate. Because unless the young, lower risk, healthy people come in to spread out the risk, the premiums, that's the only way the premiums are coming down. That's what the insurance industry is banking on. Now, people did a study that the most any individual will have to pay as a penalty in New York City for not participating on the exchange is $695.
And how is that enforced?
That's the thing. That's what people don't realize. Are
you expect to enforce this? If somebody comes into the emergency room and doesn't have health insurance, do you report them to the Obama police?
Here's the biggest sort of house of card problem with the Affordable Care Act in terms of the individual mandate, which you brilliantly touched upon. There is no enforcement mechanism. If you read the bill, the top experts have said there's absolutely no enforcement mechanism. So that is something that needs to be...
So that's how it got passed, huh?
The individual mandate says everybody in America has to buy health insurance. Roberts, the Chief Justice of the Supreme Court, says that's a tax, so it's constitutional. Everybody has to go out and buy a product. They have to buy health insurance.
Or have health insurance through their
health insurance.
But the actual, if you really carefully read this, and there have been several people that have actually published essays on it, there is no enforcement mechanism there. It sounds good, but there's nothing that says the IRS has to come after you and put a lien on your wages or anything along those lines.
So the idea is that if everybody has to buy health insurance, then young people are covering the costs for old people, and profits for the insurance companies will go up because more people are buying health insurance. And if the profits go up, supposedly the premiums go down. What in history has ever shown that health insurance companies will lower their premiums because they're making a killing?
They won't. And I will say one other thing. Other than the military-industrial complex and maybe the prison complex, over the last 10 years during the worst recession that we've ever had in our lifetimes, can you think of any other industry that had double-digit increases in price and profit year after year after year during the heat of the recession? No, right? The health insurance industry was one such industry.
So the health insurance industry There's no cap on their profits, even though they're supposed to spend 80% on the patients. They can make as much as they want under Obamacare.
Correct.
And they can charge as much as they want, and the federal government will pick up the slack for people who can't pay those premiums, which means that the insurance companies are going to raise their premiums because they can get away with it. They're not going to treat health insurance companies like a utility. No regulation.
Well, the insurance industry will argue that they're getting more regulation because they're having to cover more things. And sort of the golden days of taking 31 cents is no longer there. That 20 cents is a huge burden and a regulation on them. The problem is this. You've outlined what still sounds like a pretty nice sweetheart deal for the insurance industry, right?
Yeah.
There's no public option to compete with them, all right? And when you have to
define public option, please.
So the public option was the idea that because insurance companies don't always play nice, that there would be a government-run healthcare plan. Let's say there was Medicare that would be on the exchange, so you and I could choose, do I want to go with Blue Cross or Kaiser or Aetna, or do I want to take the government plan? And the idea with the government plan was, rather than raising prices to satisfy shareholders in return, that whatever money they made, they would keep pouring it back into the system to keep premiums low for the following year. A true not-for-profit.
But don't they, in the exchanges, don't all the consumers have to be offered a not-for-profit insurance plan?
Well, but not-for-profit when it's non-government is very misleading.
But let's backtrack for 1 second, Doctor. According to Obamacare, when you're shopping for health insurance, one of the choices you have to be offered is a non-profit health insurance group, correct?
Right, but non-profit and health insurance are really
the contradiction.
Yes, in the sense that this. I'll just explain two things. Kaiser is non-for-profit. If you saw recently, they were featured as raising premiums just as much, if not more, than a lot of the private insurers.
But Kaiser was the basis of Hillary Care, right?
Right.
I mean, that's the gold standard.
And it's to some extent the basis of the accountable care organizations that exist within the Affordable Care Act. That it's encouraging specialties to come together to form a sort of a pseudo HMO.
So you're saying that the government can run health insurance better than a nonprofit can.
Correct.
Which goes counter to what every Republican will tell you.
Correct. And there's actually data to that. So independent of an ideological slant, which is what I always say to people, is let's take a step back and look at the data. There's been lots of publications, most recently Kip Sullivan, who is a physician and also economist in Minnesota, published a paper showing that the true administrative costs for Medicare were 1.4% versus 16% for the private insurance industry.
Right. And that's a fact. That's
a fact.
Undeniable.
That's undeniable. And so I would argue Medicare would actually function better had it not been jeopardized by both the Republicans and Democrats in the House and Senate. Starting with back in 1995, during the original budget battle, everyone said Medicare was going to go broke. The Republicans at that point wanted to put 20% of all seniors who are on Medicare HMOs, or a privatized version. And they said over the next 7 years it would save $200 billion. Well, fast forward, it's actually cost over $277 billion more to do that because you had a for-profit entity that was being less efficient taking care of these people than traditional Medicare.
So part of Medicare has been privatized.
Correct. And that was the argument with the whole Paul Ryan thing with Obama's trying to cut Medicare. He was just trying to finally say to the Medicare HMOs that we're going to pay you the same thing we pay everyone else with Medicare because you have not shown better outcomes and you've only cost more money than what the traditional Medicare plan can do. Plus, we also know that...
Excuse me, I'm sorry to interrupt. Yeah. So you're saying that under Obamacare, they're taking back Medicare from the HMOs?
Well, that was the original plan. And here's the
But they're not doing that.
Well, here's where you start to realize that sometimes you don't have Democrats and Republicans, you have corporatists.
Yeah.
Because the plan was that in 2013, starting this year, that they were going to start to cut reimbursements to Medicare HMOs. And doing so, that was going to begin the savings of that $877 billion that Ryan and Romney kept saying, oh, he's cutting Medicare by that much. But what did Sebelius announce last month? That they
She's Health and Human Services.
Health and Human Services Secretary. That instead of cutting it like they said they were going to do, they're going to reward them and give them a 3.5% increase. So that's further watering down the solvency of Medicare, and that's Democrats doing that. But let's look at what the Republicans have done. First thing was I mentioned starting this whole mess by putting 20% of the Medicare seniors on a privatized plan, which has actually been more costly and less effective. Second thing was Medicare Part D, which was the prescription drug plan. And what people don't realize, and this is what I always, when I get into debates with Republicans and we don't want a government health care program, they passed a much more massive program than the Affordable Care Act. And you didn't hear anyone on the right talk about that. But that's what I think the left needs to constantly bang them over the head and say, Medicare Part D is much more expensive on a yearly basis than the Affordable Care Act was. And what that was, quote, a plan to give seniors a prescription drug benefit. What did we find out from that? It was initially started by a Republican House and Senate, and Billy Towson was the lead author on that.
Where's he these days?
He's now the president of Pharma, which is the largest lobbying group for big pharma. Making more than $2 million a year is that position. Talk about a revolving door. So he negotiates this and then becomes head of pharma. So that's what Billy Towson did. It was signed into plan. What it does is it prevents Medicare from negotiating bulk prices on drugs. As a result, we're spending about 60% more on drugs than per capita than they are in Canada on our seniors.
Right. And when Obama first proposed Obamacare, who was the first group he made a deal with?
Billy Towson. He was in the door, and they were the ones that said, we'll give a couple $100 million so that you can air ads that will be favorable to your legislation as long as you don't allow them to touch the existing plan, the deals we have with the big pharma.
So the drug companies support Obamacare, and they were in on it from day one.
Correct.
The health insurance companies?
They on one hand, they were against it, and then on the other hand, they were in it. And here's the thing that people don't realize. So there are 535 members of Congress. There were over 3,300 registered healthcare lobbyists. So roughly 6 lobbyists for every member of Congress, and they were spending $1.2 million a day. More was spent lobbying for healthcare than was on the entire Bush-Kerry election. And that's why the bill, as you mentioned, looks like it was written by the private insurance industry.
Say that again. More money was spent
lobbying for the Affordable Care Act so that it would be favorable, that there would be no public option and all of those things, than was spent on the entire Bush-Kerry election.
Wow.
Yeah. And that's why the bill looks like it was written by the private insurance industry.
That's always been the ding on the legislation, is that it's really. I've always heard it was crafted by the insurance industry, and now hearing the specifics, it seems that that's the case.
Absolutely, and I think that, again, so we have to look at the good things that are there that maybe the insurance industry didn't want, which was the lifetime caps, as I mentioned, and no rescissions and pre-existing conditions. But in the end, out of that $800+ billion, it's estimated $475 billion is going to go to the private insurance industry.
Say that again. What
out of the total cost of the Affordable Care Act is $800+ billion.
Right.
It's estimated that roughly $475 billion of that will actually go in terms of subsidies and such to the private insurance industry.
But not as profits.
No, but that's money that's going to be used to go buy their product.
Okay.
So where else do you see the government taking tax dollars to subsidize people to go buy a product from an unethical, immoral industry that only profits by denying people care?
Right.
That's the problem that I see.